A sweeping wave of concern is rising across the United States tonight as a decades-old medical shield for newborns is suddenly pulled back, leaving parents and doctors stunned. In a tense and deeply emotional decision, the CDC's Vaccine Advisory Panel has voted to end the long-standing recommendation that every newborn receive the hepatitis B vaccine within the first 24 hours of life, a move that ignited fierce debate, trembling voices, and warnings that echoed with fear inside the meeting room. 8 members voted yes, 3 voted no, and with that single motion, a critical layer of protection that generations of families relied on was abruptly stripped away. The shift has triggered heavy criticism from public health experts who warn that the consequences could be devastating, especially for vulnerable infants who have no defense in the earliest hours. Doctors insist the vaccines are safe, proven, and life-saving, pointing to years of data showing that early immunization crushed transmission rates from thousands of cases to barely a handful. Yet now, newborns may be left exposed during the most fragile window of their existence, where a single moment, a single contact, could determine whether a child carries a lifelong disease. Local pediatricians are sounding the alarm with unshakable urgency, pleading that delaying the vaccine until 2 months of age leaves a dangerous gap where infection can spread silently and swiftly. Hepatitis B is not a minor illness. It attacks the liver, it scars the body from the inside, and it can lead to cancer, liver failure, and death. Physicians warn that once this disease takes hold, it follows a child for life, and prevention in the first 24 hours has long been the only barrier standing in its way. Tonight, shockwaves are also spreading through the medical community as attention turns to the advisory committee itself, newly reshaped after several members were removed earlier this year. The panel, now operating under a different leadership tone, insists the decision returns authority to parents and pediatricians, yet many fear that the youngest and most defenseless Americans will pay the price for this shift. States like Colorado are openly distancing themselves, urging hospitals to continue offering the birthday vaccine, calling it essential, irreplaceable, and critical for protecting infants from preventable hardship. And as parents across the country struggle to make sense of this sudden change, pediatricians warn that trust, guidance, and timing may now make the difference between safety and irreversible harm, even as a recommendation.